Good morning, everybody. It's really gratifying to see people filtering in after a long time of preparation. We'll wait for a few minutes um, before getting officially started. It's especially lovely to see some little icons with faces on them. Even though they're small to see, it's nice to have the feeling that there are actual people in the quote unquote room. It's hard to decide when to get started when I can see that people are coming in so continually. And I'd like everyone to have the benefit of our welcome and intro. So I'll give it just another couple of minutes. Thanks for your patience. And thanks for being so prompt. Good morning, everyone. I think we'll wait for about 2 more minutes. I'm completely impressed with how many people are here so promptly. We'll just allow a few more people to join.
Jennifer, I don't know if you can hear me. We can't hear you.
Good morning, Jennifer. Can you hear me? Because when you were speaking, we were not able to hear you.
Thank you, everyone. Can you hear me now?
No.
Hang on, and thank you for letting me know that. Hold on.
Jennifer, we're not able to hear you.
I actually, oh,
Oh.
Can you hear me now?
Can.
Wewe bojo no jamendishna kazgaye mainga nandodem lane lanape kwe endao lanape a king ndonjaba niga baby kwe. I just want to check with everyone to make sure that you can actually hear me. I see in the chat we were not able to hear Jennifer as she was speaking earlier. Okay, thumbs up. Perfect. Great. Um, I introduced myself as Carol Hopkins. I'm from the Delaware Nation here in southwestern Ontario. My mother's family line comes from the Delaware Nation at Moravian Town, and my father's family line comes from the Delaware Nation at Muncie, Ontario. Both communities are just outside of London along the Thames River. And I've been asked to share an opening with you this morning, and so I'm going to offer an opening prayer. And as I do that, I encourage all of you to send good thoughts out into the universe. Think about your family, the community of people that you call your neighbors, your friends, your family, um, and also most importantly, think about all of those individuals and the families that you affect every day, um, whether it's directly or indirectly, and also thinking about those folks who wherever they might be who are alone in this world and not sure um, where their next meal might be coming from, or if there's anyone that cares about them. So send your thoughts of caring out to them as well. It's our belief that the Creator, the Spirit, the Great Spirit, and all of her helpers that she's placed around the universe will, um, in some way, take your message and your thoughts and your good mind and good heart, and then it will reach them somehow. Oh, um, Nuikanana, Manado, Gajamanado, Mama Wika Chimanado, Amigwachwago, Ginga Kinegego, Gigi Kendan, Ginga Kinegego, Gigi Kijaton, Amigwachwago, Ginanandaman, Gaja O Benegat Deg, the Beonjada Tabaka Ki, Amigwachwago, the Sha, uh, Manadowag, Owadakea, um, Gakina, Manado, King. Meanwhile, the Shah Yao, Nimiquinameg, Geget, Niwan, Gokumisnanek, Mishamsananek, Owadakea, Niwan Ishkondeming. Aho, Waban Nokumis, Amigwitrago, Ginganawendaman, Skibimatsuin. Meanwhile, the Shah Yao, Jawan Nokumis, Amigwitrago, Ginganawendaman, Skibimatsuin. Meanwhile, the Shah Yao, Nakanazid, Owadakea, Ningalbian, Squandam, Amigwitrago, Ginganawendaman, Gagi Gabi Matsuin. Meanwhile, the Shah Yao, Nakanazid, Owadakea, um, Giwed Shwanda Mami Gutchago Gingan Wendaman no Chumo Win. Meanwhile Shayao Gokmisananda Kawidakea um um uh Gijiton meanwhile Sha Gokmisananda Ogerika Megami Gutchago Gin Bimose Anishinaabe Mikanan. Meanwhile Shayao Geget Dadash Bushkakme Ami Gotchago Ginger Bendanga Kinabimatsuin. Shomsananek Gokumisananek Bazindawayan Ganawab Mission, Anishinaabe, but we Gwich'ton da Minaba Matsuin, Gaget, Ami Gwich'go Nangom Gishaga, Ami Gwich Bazindawayan, Miuminike Jaga Gigoro Yang, Gjamanado, Nadamao Shanang, no Kiwin, no Gishaga. Ajoanamishnanga Jamanado, Ajoanamishnanga Jamanado, Ajoanamishnanga Jamanado, Ajoanamishnanga Jamanado. So in my prayer, I was acknowledging the Great Spirit who thought of everything that we would ever need forever and all time. And in doing that work, forgot nothing and never stopped working to ensure that the possibility of life was always there before us if we seek it out. And so in that way, we think of also our grandmothers, our grandfathers that were placed in the four directions, each one of them there to support us in a very specific way to help us find our path, find the path that we were meant to walk on, to help us to understand the gifts that we were given to carry in this world, to understand our purpose. And our grandmother that helps us with the renewal of life. Every single day is a possibility for life to change, and we know that change life is not always easy. As life changes, they're not always changes that we expect or that we initiate ourselves, and sometimes the change comes without preparation. And so we turn to our grandmother and ask for that support as life moves along, that we receive the help and the support that we need. Each one of us always need support in walking on this path in life. We can't ever walk it alone. And we know that life is, that the flow of life is forever and it never stops. And that flow of life is the continuance and the promise of what our ancestors left for us. And so we remember them and how they walked on this earth and they left their tracks for us to follow. And in that way, we also honor the gift that we've all been given to walk on this earth every day, that we might also leave good tracks for others to follow. And that in doing that, that's good medicine for our relatives and for our children and for our families and for those who are coming in the future. And we think about all of you who do that healing work every day, whether it's through the way you interact with people and direct healthcare, or whether it's helping people to find their way along the path through guidance and advice and listening with a good heart, in all those different ways that you work with individuals to find their way in life. We think about that as good healing life, and so we give thanks for that. And all around the sky realm, all of those beings who watch over us every day, we think about them as well and call their attention to pay attention to the conversations and the good work that we're doing as we share this time together. And we call upon them for blessings. And then also we think of, most importantly, our Mother, the Earth, and pray for her healing as well and honor her for the life that she continues to give no matter what we do. To the earth and to our environment. She never stops giving. And we pray for her healing and we give thanks for her love. And with that, I want to say thank you again for inviting me to offer this prayer and these opening words. And I wish you all a good conference today. And some of you I will see later today. Miigwech, Weweni.
Thank you, Carol. Those are inspiring words, and I know I speak for us. We are honored that you were able to join us to share those words of wisdom and spirituality and those challenges. And we appreciate that you will be with us later as well. I would like to open on my part with a land acknowledgement. We, and I, acknowledge that the lands on which we are hosting this meeting include the traditional territories of many nations. The work of Medify and our partners takes place on traditional territories of the Indigenous nations who have lived on these lands since time immemorial. Medify is located in Toronto, on the ancestral lands of the Huron-Wendat, the Anishinaabeg, the Mississaugas of the Credit, Haudenosaunee, and the Atchawendurons. This is Dish with One Spoon Treaty territory. Medify is committed to reconciliation. We recognize that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and well-being. We respect and embrace the rich cultural and traditional practices of the ancestors. We invite our partners to reflect on the territory where they are situated and to join us in committing to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. Before moving into acknowledgements and the rest of the session, I'd like to take a minute to review some of the issues around using the platform. I appreciate that we've already had a few little mini glitches and appreciate everyone's understanding. I know one of the things that I found challenging was the very small window. So some of you may be much more savvy than I am in figuring out how to move this around, but just a quick note that you can enlarge the PowerPoint by clicking anywhere on the presentation and selecting Picture in Picture. That will pop it out into a separate window, usually in the bottom right-hand corner of your screen. And then you can click and drag it and resize it so that you actually get to see the content in the PowerPoints. It's limited, and I don't think we'll be able to fill your entire screen, but you'll be able to have a much better view of the content that's there. So with that, and we'll come back to that, I want to acknowledge the Medify team. This incredible group of individuals, an incredibly small, energetic, dynamic, and committed group of people who produce everything that you see coming out of groups with, of course, our partners, our advisory committee. And I know you'll hear it many times, but a very, very special thanks to Lori and to Sarah, who behind the scenes have done so much working with me. A thank you to our conference planning committee, who include peer advisors, representatives from nursing, family medicine, psychiatry, pharmacy, social work, hospital administration, and represent all parts of this province, including Thunder Bay, Sudbury, Windsor, Hamilton, and Toronto. This group has drawn on the Medify Advisory Committee, who provide guidance and feedback that strengthens the work of the Medify team and supports the building of this community of practice. And thank you to our presenters and all of our moderators. Briefly, because I know you all have schedules for the day, I know you'll be with us for our keynote this morning with Dr. Akwasi Owusu-Bempah. I want to particularly draw your attention to the opportunity for a networking session between 11:30 and 12 tomorrow. Not the same as getting together over coffee breaks in person, but we hope that you will use those tables to connect with people you know, perhaps meet some others. The session will not intrude on the lunch break. The table topics include substance use treatment in correctional settings, community-based withdrawal, counseling in the RAM setting, challenges and opportunities in community OAT practice, residential treatment, room for NPs in addiction care, building RAM connections to the ED and primary care, and a table about Medify and RAMs with a chance to discuss supports, opportunities, and engagement. There will be extra tables, so please feel free to invite people to meet you at a new table or table hop just to listen in. And of course, I hope that you'll stay for our afternoon sessions and our final panel with Marcus G. With that, I'd like to welcome Anne-Marie Corrado, our acting network director, who has been an incredible source of support over the year that she's been with us. And Mel Kahan, our medical director, well known to all of you, for an update on MediFI's activities in the past year and perspective on the changes coming and happening in addiction treatment in Ontario. Bear with me for just a moment. And Marie, I'll let you take the stage.
Good morning, everyone. Thank you so much, Jennifer, for welcoming me. I feel so privileged to be attending the second PHI Conference this year in my acting role, and to have the opportunity to spend a few minutes sharing some of the work that the team has done over the last year with all of you. Next slide, please. So this is just a background slide, and as many of you know, PHI became the official provincial hub for RAM clinics in 2020. A RAM clinic is a low-barrier drop-in clinic that provides substance use-related care without requiring an appointment or a referral. The underlying concept of the RAM model of care is that low-barrier, rapid access to evidence-based addiction care improves treatment engagement and retention, and therefore treatment should be as accessible as possible. And this translates into three core principles. So the first is accessible care. So as I mentioned, RAM clinics offer low barrier, drop-in accessible care without the need for referral or a pre-booked appointment. The second is appropriate care. RAM clinics provide comprehensive access to psychosocial and medication-assisted treatment for any substance use concern at the first visit, and integrated care. RAM clinics are part of an integrated care pathway that facilitates connections and promotes smooth transitions among primary care, withdrawal management, hospitals, mental health services, social services, and cultural services. Next slide, please. So in terms of the PHI initiatives over the past year, first I'm going to speak to education. So we have created two additions to the toolkit for ED management of opioid use disorder that was disseminated across Ontario in 2021. And both the methadone quick start order sets for EDs and macrodosing clinical guidelines can be found on our website. We have also been working on an ED toolkit for alcohol-related presentation that we're very excited to release in the next few months. Next slide, please. In terms of mentorship, I want to highlight that our community of practice continues to grow. We have had over 200 people join over the last year, and we would really like to encourage anyone who has not yet joined to learn more about the listserv on our website. Next slide, please. In terms of guidelines, we recently completed and disseminated our methadone carry guidelines, which can also be found on our website. And in addition, we are close to finalizing our guidelines for prescribing slow-release oral morphine as opioid agonist therapy. We continue to advocate for system-level change. And in terms of oversight, we completed the first RAM clinic evaluation last year to ensure that our directory was up to date, to generate an accurate picture of the care that's being delivered, and to find ways to support RAM clinics in providing accessible, appropriate, and integrated care. And we were very pleased to receive responses from 71 RAM clinics, and we will be completing another evaluation in the near future. As Jennifer mentioned, the work that we do would not be possible without the support of many important collaborators. And on behalf of the entire PHI team, I would like to express my gratitude to our community consultants, our provincial advisory committee members, and our many partners working in the addiction medicine field for continuing to work with us on all of our initiatives to ensure their quality and success. And of course, I cannot end off without some thank yous. So on the next slide, there's a few people that I want to thank, and I'm going to echo some of the thanks as well that Jennifer has already given. So to begin, I want to actually acknowledge and thank Dr. Jennifer Wyman, who continues to be an incredible conference chair. We are so grateful for Jennifer's leadership in putting this event together. I would also like to thank Sarah Clark and Lori Smith, both members of the Medify team, who have done so much important work behind the scenes in preparation for the next 2 days. I would like to thank all of the members of our conference planning committee, our presenters, and our moderators. And last but not least, I would like to thank all of you for joining the conference. Thank you all again, and I hope you have a wonderful time over the next few days.
Hello, everyone. I'm Mel Kahan. I'm Medical Director of Medify. I'm going to give an overview of addiction treatment in Ontario. As I'm sure all of you are aware, we are living through unprecedented times. This is a substance use crisis with fentanyl and crystal meth and alcohol, the likes of which we have never seen in modern times. But on this talk, I want to emphasize the tremendous response, the community response from people in the field to try and tackle this tremendous challenge, this monster. I'm going to start with innovative models to improve access to care, highlighting some of the innovations that are going on in Ontario. Next slide. As Anne-Marie said, RAM clinics are a different model of care where no appointment or referral is needed. Medication and assisted treatment and counseling are provided on the first visit. There is emerging research now to show the effectiveness of the RAM model in reaching people. Patients with opiate use disorder, Kim Carras and her team have shown that there is a reduction in a composite index of mortality and healthcare utilization in RAM patients compared to matched controls. Similarly, patients with alcohol use disorder who attended RAM had marked pre-post reductions in ED visits. A randomized trial, Anita Srivastava was lead author, showed that withdrawal management patients with AUD or OUD who had a facilitated visit to the RAM clinic had reduced ED visits compared to the control group. Next slide. Withdrawal management services, there's a steady attempt to make sure that withdrawal management services can provide medical care, medication-assisted treatment. Many, probably most withdrawal management services now have NPs on site. NPs work very hard to have their own guidance documents in community and practice. You can go to the Medify website for the WMS toolkit and best practices document. Next slide. Emergency departments. The Ontario Mental Health and Addiction Center of Excellence has made emergency departments a top priority. That is to say, they're working to build addiction care pathways between the ED and community services, including RAM clinics and withdrawal management services. Also, Medify has focused on the ED with materials, the toolkit on the management of alcohol-related presentations in the ED that Anne-Marie mentioned, which should be out soon. The toolkit on management of opiate use disorder in the ED, documents on take-home naloxone in the ED and hospital. And these various documents and initiatives are focusing on clinical innovations in the ED, including prescribing and dispensing naltrexone, acamprosate, gabapentin on discharge, use of buprenorphine, naloxone, and depot buprenorphine prescribed in the ED, peer workers and patient navigators in the ED, and building strong connections between the ED and RAM clinics. Next slide. Hospitals. Some hospitals have full addiction clinical consultation services with a prescriber, a counselor, and coverage at least during 5 days of the week. Other hospitals have a peer worker or a patient navigator or addiction counselor who links hospital patients to RAM clinics or other community harm reduction and treatment services. And there's very good evidence that initiating opiate agonist treatment on site improves treatment engagement and retention. Next slide. Clinical innovations. Next slide. Patient-centered care policies that arose out of necessity during COVID There's evidence that patients who were on daily observed dosing and then had improved treatment retention when they were given carries. That was a study by Gomes et al. Slow-release oral morphine is becoming increasingly accepted as a third medication along with methadone and buprenorphine, and we will be releasing a guidance document on that soon. Methadone combined with slow-release oral morphine, there are case reports that this may help treatment retention for people who use fentanyl. Macrodosing, that is using high doses of buprenorphine naloxone in the ED with early use of depot buprenorphine. This has some advantages. A full therapeutic dose is reached within a few hours. And preliminary evidence article by Dr. Ken Lee shows that depot buprenorphine is associated with marked reductions in rates of fentanyl overdose. Next slide. Improving access for marginalized communities. Buprenorphine programs in First Nations communities have been around for a number of years. They're run by the community themselves, and they have high rates of treatment retention. In Timmins, paramedics are now administering buprenorphine to people who have overdosed, and there is a conference session on that. It's quite remarkable. Mobile RAM clinics, Anishinaabe Health Toronto, mobile RAM clinics are reaching homeless Indigenous clients where they're actually living and staying. Virtual care, hub and spoke RAM clinics in northern rural communities such as Sudbury are again reaching people who have limited access to transportation. Next slide. So who's driving these changes? These changes are not top down. They're not, MetaPHI or CAMH or the provincial government. They're spearheaded by local and local care providers. They're arising organically. They're spearheaded by frontline clinicians, counselors, administrators working together who are taking the time and effort to advocate with hospitals and local and provincial funders. Next slide. There's a lot that remains to be done. The addiction system is dramatically underfunded compared to, its public health impact. The RAM clinics need more staff, and they because they need longer drop-in hours, especially if they're going to have access for the public and for the emergency department and WMS patients. EDs and hospitals need to invest in addiction services. Withdrawal management services need more healthcare staff. One nurse practitioner is not enough. And there's an urgent need to pilot and evaluate innovative clinical protocols. That includes macrodosing and depot buprenorphine in the ED and anti-craving medications in the ED and so on. Next slide. But there is a very promising future, I believe, for addiction treatment. Things are happening very fast. Addiction treatment is becoming more effective and reaching more people. More physicians and nurse practitioners and counselors are getting trained in and showing an interest in addiction treatment. Ontario Health and the Ministry of Health and hospitals are funding initiatives that integrated addiction treatment into mainstream healthcare. And all this will have a marked impact on addiction-related morbidity and mortality. So I want to thank everyone for your dedication and commitment, your courage and persistence, and your collaborative spirit. I know it's difficult and often lonely and challenging at times, but we're doing what needs to be done and it's having results. So thank you, everyone.
Thank you, everyone. We'll try to make up a little bit of time. I think I've already shared briefly, just instructions again. If you want to make the PowerPoints look bigger, to click anywhere on the presentation, select picture in picture. It'll pop into your window, and then you can drag and resize it. Please find the event agenda so you can see what's happening throughout the day and plan your day. It'll open in a side panel. The chat gives us the option of clicking on the general chat, or you can click on current room to open the room chat and ask the presenter a question. You can also click on send a direct message to select an attendee and start a conversation with them directly. And in between sessions, for session discussions, please continue to put your thoughts and questions in the chat. If you want to ask a question, click on raise your hand to indicate that you want to speak. And when you're called on, remember to hold down the hold to talk button throughout the time that you're speaking so that people can hear you when the moderator calls on you. For tips and help, you can go to the little question mark and you'll get some live support. The Frameable team is there. Sarah's in the background doing amazing tech support. So again, put questions into the chat, and in between sessions, please join the break room. There will be 15 tables with 15 seats per table. You can click on enter, grab a seat, and have a chat. Do not forget, please, to complete session evaluations. At the end of each session, there will be a link to complete an evaluation for that session, as well as an evaluation at the end of each day. We will send these links out after the conference. They're important for accreditation, but more importantly for our future planning. So please do complete them. And it's my pleasure